Well, that's one of the good things about what the healthcare system can do for those of us lucky enough to either be wealthy or live in a country that provides it. And I want to repeat that in Canada, equality, accessibility, and quality are just a given to Canadians. Now, it's true that, as my employer does, there are insurance bump-ups that one can do to increase coverage. Some of that's for private rooms, but in my case, it does cover 100% of my drug costs, which is pretty good since there's up to $1,000 a month of drugs for me forevermore. But without extra insurance, I was covered for 10 years in a prevention clinic. A very visionary woman doctor in Vancouver persuaded the government she could save money by doing prevention work on kidney disease. In any case, 10 years of care there, a kidney transplant surgery, care for the rest of my life, drugs, blood tests monthly for the rest of my life. I was never asked for money. I was never asked for a credit card. I never negotiated with an insurance company, and my family and my friends were able to focus on love and support, which I believe most of you would share is a very important part of the healing process. Now I'm back trying to see what... Oh, by the way, any of you who know me would expect me on the next panel on money, not health. I'm no expert on healthcare policy, but I am a strong believer in the interconnectedness of all things in a systems approach. And I've chosen to put my work where money is, and I'm speaking momentarily to those of you here who have the incredible privilege to own and control money, and say that applying capital towards systemic approach to problem solving, to connecting alliances, doing leadership development and capacity building, and creating circumstances like this one here at Momentum where issues can cross. You came up at 3, but I got 6. Yeah, okay. Nice clock here. Is something that needs to be done. There's a massive amount of sleeping and distracted capital, probably even some sitting here in the room among us. We have to break out of the cycle that tells us that holding on and building infinite wealth is a responsible and moral position in the world. And those of us, whether we're individuals, or a nation, we have got to apply our wealth towards looking after the people and the planet that are here today and towards future generations. We're doing things like the Tides Renewal Center in Vancouver, which is a co-location model inspired by Tides' work here with the Thoreau Center for Sustainability. 30,000 feet of Canada's first LEED-certified leasable office space that will house some wonderful social entrepreneur organizations in the Delta sector and in the money-making sector. We're launching a social venture investment fund called Renewal 2 that builds on our 15 years of making investments that are attempting to support those who are creating solutions, particularly in underrepresented sectors of the economy that don't have massive venture capital and money behind them. That's going to welcome investors and make investments all over this continent, and it also is available to charitable foundations who want to do mission-based investing. I have a little green, you can only see a little green dot here. This is a political button for one of my best friends, whose name is Gregor Robertson, who as an entrepreneur built a very successful company in Canada called Happy Planet, which provides organic foods and juices across Canada on a deeply systemically thoughtful rationale of the impact of the business. Gregor decided that he had to have more impact and that he would try that through politics. And in a stunning victory recently in what was a people's and new media type campaign, especially for Canada, the largest number of members ever for a municipal party in Canada, at least I understand that to be correct, Stephen, came out to join a new center-left party called Vision Vancouver and nominate Gregor to run for mayor of Vancouver on a social and environmental sustainability platform. Gregor was also a founding board member of Tides in Canada. Another one of our initiatives is to build a substantive national public charity that can support a full range of social and environmental and other progressive issues in Canada. It was in the face of overwhelming global and human problems. Maybe this experience for me is analogous to get up here and talk right now of what I felt as a young man when I was diagnosed with what may have been a death sentence, which I took as a life instruction message. Whatever resources we all have, we have a responsibility and an obligation to put them to work now, not tomorrow, but now, for the things that we believe in and care about. We need national health care in this country. Think about the impact on the psyche of humans in a nation. And everyone before me has laid this out, but who have to worry about whether they can keep their home, whether they can whether they can care for what's wrong with them. Think about the economic impact of having employees who know that they can get health care rather than fear and not go to their appointments because they're worried about money. We need national health care. And when you hear about all the horrible things about the Canadian system, some of them are correct. There are long wait times sometimes for people with non-life-threatening and elective challenges, and they suffer from that mentally. There are my hospital and many of the medical facilities could use an upgrade. There are a number of things that are imperfect in this system. But when you hear how bad it is, be sure and think twice and take another look. It's crucial that people, particularly in the wealthiest nation in the world, can feel safe about their and their family's health. So thank you for hearing my story.